Carly. How are you doing today?
Good, how are you?
I'm good. So we're going to go through your medical history together real quick. Do you have your INR form?
Yes, this is my INR. I just went to the doctor yesterday.
Okay, great. Okay, wonderful. So have you had any changes in your medical history? Are you still on your warfarin?
Yes, I'm still on my warfarin, but about a few weeks ago my doctor changed the dosage from 4 milligrams to 2 milligrams.
Okay, let me make that change. So, do you have any of the side effects like your severe bleeding, stomach pain, headaches?
Nope.
Okay, great. Awesome. Why do you change it?
Because I've been exercising a lot lately and he thought my health was getting better, so he thought I could handle a lower dosage.
Okay, I thought you looked like you had a little bit more pep in your step. Now we're going to check your vital signs before we get started with any tests.
Courtney is monitoring her patient's vital signs, like monitoring blood pressure, blood sugar, and taking her pulse.
Okay, so everything looks good. So how are your grandkids doing?
Good. Ansley just started kindergarten and Adley is in pre-K.
Okay. So, are they liking school so far? Oh no. Call 22222.
I'm on it.
She's having a stroke. I'm going to put you in the supine position.
Emergency help's on the way.
You're going to be
There's
okay.
some oxygen. So Carly is experiencing a conscious stroke caused by cerebral thrombosis. This occurs when the patient's brain is deprived of oxygen. We checked and saw that her saturated oxygen level was lower than 94%, and that is why we were administering oxygen.
Okay, so now that we have gotten you back to normal, how do you feel? Is everything okay?
What just happened?
Did you just we think you might have had a stroke. Is that like a normal thing that ever happens?
No, it's never happened before.
Oh, wow, okay. Well, the EMS is on their way. They're going to come and take you to the hospital to check everything that's going on with you. We're going to not do any treatment today. We're going to just have to schedule that for a later date.
Okay.
Is that all right? Because
That's okay. I just need to lay down, I think.
In the moment, it is difficult to differentiate between transient ischemic attack and a complete stroke. But after observing that Carly could hear us and was aware that we were talking to her, we concluded that she was a conscious patient having a cerebrovascular accident.
When your patient is experiencing a stroke, they may be conscious or unconscious. If the patient is conscious, you will place the patient in a semi-reclining position, monitor the vital signs, check for the blood sugar, seek medical attention, provide oxygen if the oxygen saturation is below 94%, and transfer to the hospital via an EMS. If the patient is unconscious, you will place the patient in a supine position, record the vital signs, check the blood pressure, provide basic life support, provide oxygen if the oxygen saturation is below 94%, and transfer to the hospital via EMS.
There are two causes to a stroke. One is a cerebral thrombosis. This is a blockage in arteries supplying oxygenated blood that will result in damage to affected parts of the brain. Another is a cerebral hemorrhage. This is an aneurysm or other weakened area of an artery that bursts. Cerebral hemorrhage is often associated with hypertension. These have two effects. An area of the brain is deprived of oxygenated blood, and pooling blood puts increased pressure on the brain, displacing tissue and interfering with function.
Stroke and cerebrovascular accident signs and symptoms are as follows: headache, confusion and or dizziness, loss of function of extremities, usually on one side of the body, collapse, facial flaccidity and loss of expression, impaired speech, unequal pupil size, rapid full pulse, difficult respiration, nausea, seizure, and coma. Hey Carly, how are you doing today?
Good, how are you?
I'm doing well. So we're going to review your medical history before we get started with your treatment today.
Okay.
So, have you had any changes in your medical history or medications?
Nope, everything's the same.
Alright, so you're still taking your 50 milligrams of topiramate, correct?
Yes.
And that's for your epilepsy?
Yep.
So, are you having any of your side effects?
Nope, I haven't been dizzy or nervous much lately.
Okay, wonderful. So, with that done, when was your last seizure?
About 6.5 months ago.
Okay, great. Well, now that we've got that, we're going to get started on taking your vital signs.
So Courtney is checking for her patient's vital signs, like checking the blood pressure, the blood sugar, and her pulse.
Alright, well, you look good and healthy, so we're going to get started with your dental treatment.
Okay.
What flavor toothpaste?
Strawberry.
Great. Now I'm going to lean you back now, is that okay?
Yes.
Alright. So, alright, let me grab everything for you. I don't know, she's having a seizure. Can someone give me the oxygen?
Here you go.
Thanks. She's still seizing. Hold her head still and keep her mouth I got airway open. Alright, it looks like it's subsiding. I'm gonna keep her here for a few seconds. Roll her over slowly. Carly, are you here?
Yeah, what just happened?
You just had one of your epileptic-induced seizures. We're gonna leave you here for a few seconds, few minutes. So we're gonna postpone treatment and resume that at a later date. Who can I call to come pick you up?
My mom, please.
Mom. All right, I'll get on that.
Courtney is keeping watch of her patient's vital signs, maintaining an open airway and using suction if possible. Because the patient has had seizures before, you do not have to call for emergency help. However, you should call 911 if it is the patient's first seizure. If the patient has difficulty breathing after the seizure, if the patient has had other seizures after the first one, or if the patient has any health conditions such as diabetes or is pregnant, you should also call if the seizure lasts more than 5 minutes. During a seizure, administer oxygen by mask or nasal prongs. Use suction to help keep an airway patent. After a seizure is over, maintain an open airway. Remember that full recovery occurs within 30 to 60 minutes.
You can see we administered oxygen to our patient. Carly was having an epileptic seizure, and we believe it was induced because she was not wearing her tinted glasses under the clinician's light. We left the patient in the dental chair. We loosened any tight clothing, relocated all the dental instruments and supplies, ensured safety of the patient, turned the patient to the left on her side because the stomach is located on the left side, and this helps prevent aspiration.